Hi everybody, I hope this finds you all well. I'm Heather Knox, Chief Executive here in NHS Lanarkshire, and this is my weekly video update for staff. Normally what I do is update everybody on the numbers around COVID and add in any other bits of information that I want to share. So today I'll start by giving you those numbers. 837 new cases reported yesterday. Our inpatient COVID numbers have gone up over the last couple of weeks and we're over 100. They're down today at 92. So the phrase that is being used is oscillating, and it definitely is going up and down for us here in Lanarkshire. 3 patients in ICU with COVID. And probably of more concern to myself is that we now have 23 care homes with outbreaks, and that is a cause for concern because often we see the care home outbreaks at the beginning of a further wave. Now, I'm not suggesting we're having a further wave, but that is a cause of concern and something that we need to watch quite carefully along with the NHS 24 numbers, because we're not quite sure what this variant will do. What we're seeing now is the proportion of BA2 Omicron overtaking the earlier Omicron variant in terms of the number of cases that we're analysing in Lanarkshire. And we do think that BA2 variant is slightly more infectious, so that might be pushing these numbers up a wee bit. So that's the update around COVID. And I wanted to also just say thanks to those of you watching from Wishaw, because myself and our new chair, Martin Hill, had a very enjoyable afternoon on Monday visiting Wishaw Hospital. I have to say it was very busy. It often is very busy, isn't it, at the front door on a Monday afternoon in ED, and the waiting area was absolutely packed. I just take my hats off to the staff who just get their heads down and work through all of seeing all of those patients. And I know it is difficult, particularly given the footprint at Wishaw, and it's difficult in ED. The ED is really not big enough now for what we need to do, and we are looking at ways of changing that going forward. We then visited the acute receiving units and met staff there, which again was really helpful and useful to see what's been put in place around respiratory pathways and other ways of streaming patients through the hospital. We then visited the trauma wards and the trauma hub, which again was good to see and to meet staff in there. And then finally we went to see the wee babies up in neonatal and spoke to staff there about the neonatal unit and the fabulous care that they provide. So just want to say thank you to all those teams, and also to the senior hospital team who we met with at the beginning of the visit, and spent a bit of time understanding some of the issues facing the site and what possible solutions we could bring or help with on a Lanarkshire-wide basis. So just to pass on thanks to all staff involved in that visit. The other thing I just wanted to say today was I'm now on day 4 of doing my own call, and it's actually really heartening to see how the teams are working together across the 3 acute sites within Lanarkshire amidst what have been very difficult circumstances. So I just want to thank all of you personally that undertake on call and that do that at site level in particular, because it's not an easy job to do, and I do appreciate all the efforts from everybody in trying to manage flow, particularly during the out of hours period. So I just wanted to say that as well today. So thank you, and thanks very much for listening.